Welcome. My name is Dr. Peter Strong, and I am a professional psychotherapist and specialist in mindfulness-based therapy, which I offer online via Skype. I'd like to talk to you today a little bit about anxiety and how to overcome anxiety using some of the techniques that we teach during mindfulness therapy sessions. One of the primary techniques that we'll focus on in these few minutes together is the problem of what we call the problem of identification, or the problem of becoming. This is kind of an interesting topic that the Buddha talked about in great detail in his teachings, and it is quite fundamental to the problem of anxiety and depression and other forms of emotional suffering. You see, it all starts when an emotion, a thought, a belief, or any other mental object, as we call them, arises in consciousness due to some form of conditioning. It gets activated, maybe in a relationship, someone says something, and it causes us to suffer in some way. Anxiety, depression, or anger may arise. Now, that's the first part of the problem, if you like, is what we call a primary reaction. Due to conditioning and circumstances, the thought arises, and there it is in the mind. But that's only the beginning of the problem, and it's actually not the major problem. Just because an anxious thought arises does not mean that we have to become anxious. Or just because an angry thought arises does not mean that we have to become angry. But for most of us, of course, we are not able to make the distinction. So the thought arises, and then instantly we become that thought. Or the emotion arises, and instantly we become the emotion. So anger arises, we become angry. Anxiety arises, we become anxious. So the first part of working with anxiety or depression or any emotional reaction for that matter is to simply see the reaction as it arises. There is a thought, there is an emotion, there is a memory, there is a trauma. It has arisen in me, but it's not me. So we begin to generate a relationship with the thought, the mental object, with the emotion, with the trauma, with whatever it is. We begin to develop a relationship with it rather than becoming it. And this is the most important first step that we teach in mindfulness therapy and mindfulness psychology. How to actually see what has arisen in the mind without becoming lost in it. So this is the first step that we teach. If you are suffering from anxiety, I would suggest that you sit down very quietly and actually meditate on that anxiety and try to see those reactions and those thoughts that arise that try to suck you in to becoming anxious. And when you notice those negative thought patterns, don't fight them, and certainly do not ignore them, but rather greet them with a simple statement. I see you. Welcome. You take your place, and I'll take mine. My place is at the center of this big field of awareness in which thoughts arise and do their dance and try to suck us in to becoming the thought or the emotion. So you can train yourself through mindfulness to recognize the emotion or the thought, and then to simply kind of say, yes, I see you, thanks, but no thanks. Then at that moment we begin to generate an instant of choice, of freedom from that thought, emotion or painful memory, so that we do not then fall into the trap of becoming lost in the thought or emotion and then proliferating and catastrophizing and generating all of the negative worrying and the sort of speculative thinking that just creates more and more suffering. So this is one of the first trainings in mindfulness work that we do together, and try it for yourself and let me know if it works for you. Thanks.